Alright, so today we're going to be talking about screening for gestational diabetes. So, gestational diabetes is a condition that can occur during pregnancy. During pregnancy, our bodies go through a lot of changes. Some of these include increase in blood volume, more hormones, increase in fluids, and another one is an increase in sugar. Our bodies need sugar for energy, and it's good for our baby as well. But this increase in sugar, sometimes our bodies can have a difficult time processing it. And when our blood sugars are too high during pregnancy, this is referred to as gestational diabetes. So the standard of care in the United States is recommended that all people are screened for gestational diabetes during the middle of their pregnancy. So usually around 26 to 28 weeks. This is when our bodies will have an increase in blood volume, and so it's an excellent time to check it. In midwifery care, we believe is informed consent and informed decision making. So we give you all the options and the risks and the benefits of both, and then we encourage you to make the decision based on your body. So some of the risk factors for having gestational diabetes, the first is going to be pregnancy. After that, we've got being older than 25, having a BMI greater than 30, if you have a history of gestational diabetes during your previous pregnancy, if you have history of several miscarriages of a stillborn baby, or a baby who is greater than 9 pounds, a baby with birth defects or congenital anomalies, if you're African American, Native American, South or East Asian or Pacific Islander, if you have a history of polycystic ovarian syndrome, if you have hypertension, or if you have a first degree family member with diabetes. So that would be mother, father, brother, sister, or if you are currently being treated for diabetes prior to your pregnancy. So considering all those risk factors is an important part of making your decision. If you have diabetes and it's not controlled, it increases your risk for developing preeclampsia, which is a serious condition that's characterized by high blood pressure and poor blood flow. It increases your risk of birth trauma and cesarean section from having a large baby. And pregnancy is like this perfect little window into what your life could be like as an older person. And so if you do have gestational diabetes, it's a good precursor that you may develop diabetes later in life. And so knowing that you have it now, adjusting your diet and your lifestyle can prevent it from having it later. Some of the risks for your baby would be a premature birth, an increased risk of stillbirth, birth trauma, breathing difficulties. The baby could have difficulty maintaining their own blood sugar levels. They are at an increased risk for diabetes later in life, as well as obesity. So some of the options for screening include a glucose tolerance test and a glucose challenge test. So the tolerance test would include 50 grams of glucola. So you start fasting an hour and a half before your appointment, and then 30 minutes before your appointment you drink the glucola, and then you come in and we draw your blood sugar level. So this is called a tolerance. So if this test, if you if your blood sugars are under a certain amount, you're considered passed. If they're over, then we would need to do a diagnostic test, which includes a fasting blood sugar and then a 2-hour blood draw and a 1-hour draw. So, considering all these options, here's the form where you can decide if you want to test and the different things. If you have any other questions, let me know.